Dr. Komil, if ready, we can start.
Yes, sir, we can start.
Okay.
Hello, good afternoon. My name is
Good
Dr. Zahid.
afternoon. Yes, doctor.
I'm one of the doctors in the clinic today. Are you
Yes.
Mrs. Lara, 53 years of age?
Yes, I am Lara, doctor.
Nice to meet you, Mrs. Lara.
Thank you, doctor.
Okay, so Mrs. Lara, we're here today to discuss about your health condition, if that's all right.
Yeah, please, doctor.
So can you tell me about your complaint in detail?
Really, doctor, I have suffered many times swelling affect my lips and my face. Last one was 3 days before only.
Okay, and for how long have you had these episodes?
First time was 3 months before.
Okay, and before that you were perfectly fine?
Yeah?
Can you tell me how frequent are these episodes?
Actually, doctor, I have developed these episodes about 10 times over these last 3 months.
And for how long does it last?
Sometimes improve within 24 hours and sometimes need 2 days to improve.
And can you tell me that does it involve swelling of any other part of the body besides your face and lips?
Yes, I notice also swelling in my hands.
Okay, what about your feet or your tummy? Anywhere
No,
else?
no,
Okay.
only my hands.
Can you tell me what were you doing at that time when you developed the swelling?
No, doctor, it comes suddenly, really. I cannot remember what I was doing.
Anything that you applied to your hands or face caused it, you felt, or anything you ate,
No,
any particular food, allergy to anything?
I cannot recognize, really, doctor.
And it starts suddenly or gradually?
Yeah, it starts suddenly but increase gradually.
Okay, and how does it go away?
Also, it's resolved spontaneously without anything.
Okay, you've not taken any medication, right, for
No,
it?
no.
Okay. Do you think that anything makes it worse, like any foods, any cosmetics, anything that you do?
Really, doctor, I try to notice anything, but really I fail to see anything can cause it.
Okay. And is it associated with any rash anywhere?
No rush.
Okay. And do you think there is any difficulty in breathing at that time?
No,
Any difficulty in swallowing or any skin changes, like any blueness?
no difficulty of swallowing, doctor.
Okay. So, have you ever felt dizzy at the time or ever lost consciousness when you had these episodes?
No,
Okay. Besides this swelling, do you have any other complaint?
no, doctor. Only I feel like burning sensation over the area of swelling.
Okay. And is there any particular time when you have the swelling, or it can come at any time, day or night,
It can come any time, doctor.
right? Um, so besides that, do you have any other complaint, like any problem with your eyes, any redness, watering,
No,
any joint problems, any
no,
pain or stiffness in joints?
no,
Okay. Any problem with the waterworks?
no,
Any frothiness or
n-
blood
no.
or pain in your tummy?
Yeah, really, doctor. Also, this when I have this swelling, also I have this tummy pain.
Okay, where is this pain present? Can you tell me more about
Actually,
it?
affect all my tummy, but really more at around the navel.
Okay, and this starts before the pain or before the swelling or after it or along with it?
Almost together.
And it resolves with this
Yeah,
as the
yeah,
swelling.
yeah, yeah,
Okay.
yes.
What type of a pain is it?
Really, doctor, it's sharp pain.
Okay, and how intense is it on a scale of 1 to 10?
It's moderate to severe, doctor, about 5 to 6.
Does it go anywhere else?
Yes, affect all my tummy.
Like you say, it is around your navel, but it is
Yeah,
also present in the rest of your tummy as well.
yeah.
Okay. And anything that makes this pain worse or better?
Really, doctor, I tried some painkillers, but not much improve.
Okay. Any change in bowel works along with this pain?
No,
Like any blood or hard or loose motions?
no, My
Okay.
motion
Any
normal.
yellowness of the eyes or feeling sick?
Yes, I'm feeling sick also during this tummy pain.
Have you thrown up?
No,
Right. Um, Other than that, do you have any racing of the heart
no,
or chest pain
no,
or any difficulty in breathing? Do you feel breathless at any
no,
time?
no, doctor.
Okay. Any cough or phlegm?
No,
Okay. Do you have any problem adjusting to temperatures or any change in appearance or hand,
no,
feet size? Right.
no, no, doctor.
So, can you tell me that do you have any past history of significant illness? Any raised blood
Re-
pressure, raised blood?
yes, doctor, really, I have hypertension.
For how long is that?
Only diagnosed about 4 months before.
Okay. And other than that, any other problem? Any kidney problem or
No,
any allergy
no,
history? Nothing.
no, no, doctor.
Okay. So can you tell me what medications you're taking?
Now I'm taking amlodipine 5 milligram because really when my GP diagnosed me as hypertension, he gave me medications called enalapril. But when I developed this swelling first time, he told me should stop it. And he told me maybe this swelling because of medication. And he gave me later on this amlodipine 5 milligram.
For how long when did you stop this enalapril?
No, for only few days, doctor. I took it few days when I have this swelling. I review my GP. He told me that this may be because this medication, and he stopped me.
Okay. So, but this problem did not resolve with stopping the medication, right?
After he stopped medication, yes, I have developed this about 6, 7 times.
Okay. So, any recent change in the dose of your medication of amlodipine,
No, only 5 milligram I took.
and you're taking it regularly?
Yeah?
Any other over-the-counter medicine?
No.
Okay. Sorry for this awkward question I ask all my patients. Any illicit
Yes.
drugs?
No, doctor.
Okay. So, anyone else in your family having a similar complaint?
Semicarbon, no.
Okay. And any
But my,
disease
my,
that
my,
runs
fa
in?
my father, yes, has also hypertension.
Okay. Any other disease besides hypertension in your family of
No,
like any cancers or sudden deaths, anything like that?
no, doctor.
Okay. So have you ever been hospitalized due to this complaint or any other complaint in the past?
No.
Okay. So, Mrs. Lara, I want to ask you some other personal questions, if
Yes,
that's
doctor.
fine.
Yes.
Uh, are you in a relationship?
Yes, I'm married, doctor.
Okay. How many children do you have?
I have 2 sons.
What are their ages?
One of them 6 years and the other 8 years.
Any history of miscarriages?
No,
Right. Okay. So any history of clots in your legs or lungs?
no,
Any recent travel?
no.
Okay. So Mrs. Lara, what are you doing for a living?
I'm teacher, doctor.
Okay. And do you smoke?
Yes, I'm smoking.
How many cigarettes a day? For how long?
I'm smoking 10 cigarettes daily since long time, doctor, really.
Okay. Well, it is suggested that you should try to stop smoking because it can be injurious to your health. We can help
Yes.
you out if you are willing by referring you to the smoking cessation clinic.
Is there
Okay.
any relation between this problem and smoking, doctor?
Does not seem to be directly related, but it can also cause other problems, like it can cause heart problems and other
Yeah,
strokes, and can worsen your hypertension. Your raised
yeah,
blood
yeah,
pressure can be
yeah,
affected. So,
yeah, yeah. Okay, doctor,
okay.
thank you.
So, what about alcohol?
I drink only 2 units a weekend.
Okay. So, Mrs. Lara, one thing I want to ask you: do you have any itching with this swelling? I forgot to ask this.
No, no itching.
Okay, and you said there are no rash, no raised areas
No,
on
no.
right, right. Okay, and fine. How is this problem affecting you?
Really, doctor, may affect me much more because when I have this swelling, I have difficulty to go to work, and also many people ask me what happened with your face, why is your face like this? So really, it affect me.
Okay, I'm really sorry to hear about that. We'll try to sort your problem out,
Yeah, doctor, I
and we
appreciate.
can also if your work is getting affected, we can talk to the occupational health department until it is
Yeah, really,
sorted out.
because when I have this swelling, really, I find difficult to go to my job.
Okay, okay. We'll try to help you.
Thank
So,
you.
Mrs. Lara, may I know what are your, just want to summarize this before and let me know if
Yes.
anything is missing. For the last 3 months, you have been
Yeah.
having approximately 10 episodes of this swelling of the face and lips and hands, and
Yes.
not associated with any difficulty in breathing or swallowing with that. There's
Yeah.
no itching or raised areas or rash along with the swelling. And
Yes.
you have a past history of raised blood pressure for
Yeah.
diagnosed 4 months back, for which
Yes.
you were
Only yes.
started on enalapril. Now it's
Yeah.
shifted to imlodipine for
Yes,
5
doctor.
5 mg, right?
Yeah.
And this is the only main thing that I got.
Yeah.
And you also have tummy pain along with this at the
Yeah.
time of the swelling, your
Yes.
tummy pain and
Yes.
feeling sick, right?
Yes.
So, what are your concerns, Mrs. Lara?
Doctor, my GP told me first time that this swelling may be due to this medication in Labril. But really, I stopped it since now about 3 months or more. But I still have this episode. So what can be the cause?
Well, Mrs. Lara, I have some causes in my mind, but the main cause I feel is a condition called as hereditary angioedema.
Yes.
This is a condition in which there is a lack of certain factors, certain substances in the blood that can result in these recurrent episodes of this swelling on the
Yeah.
face. Sometimes it can be precipitated by certain blood pressure medications like enalapril. But in your case, since it can, even after stopping the drug, it
Yeah.
can happen for a few months later on as well, which is
Oh.
called as drug-induced angioedema. So these are
But
the two things in my
but
mind.
will resolve later on, doctor?
Um, Usually, well, this is variable from patient to patient. We
Yeah.
cannot really predict it, but in most cases, there are chances that it may resolve. In
Yeah.
some cases, it can continue for life, but we can give you treatment to prevent these episodes.
Yeah, doctor. So I will improve if the cause of this swelling is medication. So will improve with the future.
If the cause is with medication, it may improve, but if it is hereditary, which means that it runs in families and it is inherited in you, in your genes, then there is a chance
So
that it may still happen.
how can know, doctor, that this is by medication or by, as you mentioned, that family?
Yes, so Mrs. Lara, for that, I will have to do some tests, which will
Yes.
include some blood tests and some
Yes.
imaging.
Yeah.
And I will arrange another follow-up meeting with you to discuss the results of those tests.
Yes.
Until then, we can give you some anti-allergic medications,
Yeah.
and then we can discuss the results and your further management plan.
Yeah. Okay, doctor. I appreciate. Thank you.
Thank you. Any other concerns, Mrs. Lara?
No, doctor.
Okay.
But
Do
you
I have
have
time?
1 minute.
I think then I must have missed some. Uh, I asked everything.
Okay, doctor. Thank you very much. Dr. Comment. You ask everything, but I repeat my comment for anyone. Why don't do full systemic review? This is short history, short information in this scenario, but you should do full systemic review. I will give you an example. You don't ask me about if the patient has any signs of malignancy,
Oh yes, I
anemia,
missed those. I
mumps
missed
or
that.
lumps. Yeah, thyroid
Hmm.
disease. You don't ask me about thyroid
I
disease.
asked about problem adjusting to temperatures, but I missed the this general review. Yes, you're
Thyroid
right.
disease. She's female. You should ask about periods. Yeah, you have many things. The
I didn't
examiner.
ask about periods because she's 53, so I didn't know
Yeah,
how. What should I ask?
maybe she has bleeding now. Okay,
How should I ask?
I mean you are in station 2. So
Hmm.
station 2, already you have time now, and this is old format. Sometimes you have time, especially if there is no many information given by the patient, like this history.
Yes.
So you should ask more. Also neurological symptoms, any numbness, any weakness, anything. And you should complete systemic review, because here sometimes systemic review not mean that the patient will have anything from this system. Only to do systemic review. طيب, now we'll discuss, and after that we can tell what we forget to ask in this scenario, and it's important. What the diagnosis?
I put hereditary angioedema and ACE inhibitor induced angioedema as
So,
different.
which is first?
Um, I will. She has no family history of similar complaint,
Yes. And
so I think ACE inhibitor.
it's not necessary to be family history in
Mm.
angioedema. Yes, you are right. Yes, you are right.
Hereditary
And
would be on top because she has abdominal
yeah,
pain as well, so that's common in that.
okay. I will give you my diagnosis. For me, this is ACE inhibitors induce angioedema, and maybe the other differential diagnosis can be hereditary angioedema. Why? Because many patients will, with hereditary angioedema, their symptoms will start when start to take NC inhibitor or non-steroidal and will continue later on. Yeah, will provoke the history initially will provoke with medication, and after that will continue to have these symptoms. Okay, so but ACE inhibitors, why ACE inhibitors? This case, it came this diet, and the examiner asked the candidate this question, same question asked by the patient. Doctor, I stopped to take ACE inhibitors. I stopped to take enalapril, but why I still have this angioedema? So what's your answer? You answer the patient correct, but what now for examiner?
Yes, it can even happen for if for some time after stopping the
Yeah,
medication.
this is the issue. This issue that the patient can suffering also episodes of angioedema even when he stop ACE inhibitors, and this can be last for up to sometimes 3-4 months or 4 months. The patient still has episodes of angioedema. So this is the answer, and this is can reassure patient for this. Yes, we'll do some blood test, and most likely this because due medication, and this will take time. As you mentioned, it's correct answer for you. So what are investigation you will do for patient?
I will do the full baseline workup, including the complete blood picture,
Yes,
ESR and CRP.
yes,
Then I will do serum electrolytes and renal function tests to rule out any problem, although she does not have any urinary complaints.
yes,
And we can do the liver function tests. The
yes,
main test for this is C1 esterase inhibitor levels.
yeah,
And we can also do the allergic testing, although she gives me no history of urticaria, but we
yeah.
can do allergy testing as well in her case. And
So there's any definitive laboratory test to diagnose ACE inhibitor induced angioedema?
mm,
No,
I'm not sure.
no.
No. Okay.
What the most common type of angioedema? We have many types, but yeah, we have ACE inhibitors, we have other medication induced angioedema, we have also hereditary. So which is more common? ACE inhibitor induced angioedema or hereditary angioedema?
I think ACE inhibitor induced
Yeah, more more common.
more common.
Okay. What treatment you will give the patient?
In this case, we will stop the precipitating factors. We can give her
Yes.
antihistamines
Yes.
and uh, maybe a short course of steroids. And we will, if she is having deficiency of, we'll stop obviously the ACE inhibitor has already been stopped. For hereditary angioedema, we can give her C1 esterase inhibitor concentrates. And other than that, although she does not have any complaints of like shortness of breath, any anaphylaxis, in that case, we would have prescribed EpiPen as well.
Yeah. So usually the medication that effective in aborting attacks of angioedema and hereditary angioedema, usually this is medication C1 inhibitor concentrate, okay? And we have also two other medications called one ecallantide and icatibant. This is medication,
Icatibant.
yeah, and also possible fresh frozen plasma if not available. This medication, like in our
One was icatibant and the other was?
ecallantide, ecallantide.
This will be given like
Also
lifelong or?
apporting medication. This is will apport the attack itself. Okay, but if for lifelong treatment, if required, usually in the hereditary angioedema, usually we give androgen like ketoconazole medication. Okay, طب what you will advise the patient, this patient who have experienced ACE inhibitor induced angioedema, you should educate her about
To
that
avoid ACE inhibitors, yes.
to avoid ACE inhibitors in the future also. But what about also, you can advise here that the risk of recurrent episodes of angioedema in the first few months after ACE inhibitors uh, will be will be resolved with that time.
Okay.
طب, what are causes of angioedema without urticaria? Here
Other than that, it can be SLE, lymphoma, and
yeah,
I
very
can remember
nice.
these.
Yeah, so I told you that about this issue. So we have usually five main causes of angioedema without urticaria. ACE inhibitors induced angioedema, angioedema caused by other medication like non-steroidal anti-inflammatory also, acquired angioedema due to C1 inhibitors deficiencies. This is usually associated with B-cell lymphoma or autoimmune disease. B-cell lymphoma or autoimmune disease. And fourth cause, hereditary angioedema and also idiopathic. We have idiopathic angioedema without urticaria. Okay? So we have five causes usually. We should know it because in our history you should concentrate on it. Okay? So why I told you you should ask me about mumps or lumps in body, change in weight. You asked me, I think, change in weight. Ask me
Yes,
about signs of anemia that can be seen in B-cell lymphoma. You should ask me about any infections before, like this. Okay, so hereditary angioedema. What do you know about hereditary angioedema?
It runs in families, and it is associated with C1 esterase inhibitor deficiency. And along with the facial swelling, patient also has recurrent episodes of abdominal pain. There may be history of surgeries like appendectomy or
Okay.
recurrent abdominal surgeries.
So what the type of inheritance? What the mode of inheritance?
I think it is autosomal dominant.
Autosomal dominant, yes, you are right. Most patient will report a family history, and really be sure that in examination, if it's family, they will mention you for your family history. Okay? Okay. First of all, I will tell you. Okay, thank you, doctor. I will discuss some issue.
Thank you.
Thank you. Dr. Komal, give the patient a chance to talk sometimes. And you first, because there's one only note for you, this is what. You told me that, hello, I am Dr. Komal directly, and you don't give me the chance also to tell you, yes, doctor, hello, doctor. And you talk, I am Dr. Komal, I directly you complete your talking. Better to give him, and to hear him. Yes, welcome, doctor, hello, doctor. And hear him when he talk with you. Okay. Also, I have other question for you. What about angiotensin receptors blockers?
They can also precipitate it. If he is allergic to ACE inhibitor, then he'll be allergic to ARBs as well.
Yeah, you should advise patient to avoid it or no?
Yes, we should.
No. According to UpToDate, in patients with history of ACE inhibitors induced angioedema, we suggest not avoiding angiotensin receptors blockers.
Okay. Right.
But you should balance. And if you have, and you can start first, you can start amlodipine or the other types of medication. But if there's indication to give, so you can give. Okay.
Right.
So why today I discuss this case with you? Because it's common in PACES exam, very common in PACES exam. Actually, every diet the candidate will face angioedema, and I don't know why they like it in exam. Maybe because sometimes can be safe living, or sometimes it's because it's rare disease. Really, it's not common disease. But we should know everything about it, and especially for ACE inhibitors induced angioedema. Usually, no urticaria and no itching. Only the patient had swelling of the lips, tongue, and face. And usually, symptoms. This is one time they come in the examination that the patient start to develop symptoms after many months or many years after introduce ACE inhibitors. So you should know that also. And symptoms typically begin during the first week of treatment, but also some cases develop after years of therapy. So this is very important also. If you have patient now has symptoms of angioedema and he tell you I'm taking this medication, ACE inhibitors, since 1 year, since a few months, since 3 years, yes, can be. You should tell the examiner that can be ACE inhibitors induced. So I should stop ACE inhibitors. And also, especially if there is no family history, and you should counsel the patient that this is due to medication and this usually will resolve when you stop medication. This is very important. This is also one case come in examination like this. Really, there are many scenarios in examination. One of scenario, this is year that the patient stop medication and still has episodes of angioedema. 1 year come that the patient taking ACE inhibitors since many months or since years also. You should also put in your mind that this can be due to ACE inhibitors. Diagnosis of ACE inhibitor induced angioedema, it's made clinically because there is no definitive laboratory test that can be diagnosed this case. Okay. The primary acute treatment for ACE inhibitors is supportive care until the angioedema resolves. But very careful attention for airway is critical if tongue or laryngeal swelling is present, because airway obstruction occur in up to 10% of cases. For hereditary angioedema, this is usually bradykinin mediated. As we mentioned for you that sometimes the symptoms can start after initiation of ACE inhibitors. Okay, also for hereditary angioedema, sometimes the patient, their episodes can start after initiation of ACE inhibitors. Okay, as we mentioned for you that patient should be counseled that the angioedema can recur in the first few months after stopping ACE inhibitors, and give him advice about how to proceed if the symptoms develop again. Now, how can approach any patient has face swelling or facial swelling? First of all, as we mentioned, Doctora, onset, when it starts, course, how many times have this episodes, duration. Usually for angioedema, usually self-limited episodes can last from 1 to 7 days and followed by a disease-free interval. So the episodes usually self-limited, improve spontaneously within 1 to 7 days. Attacks, any previous attack and how many attacks he has before. Distribution of swelling, where this swelling affect all the face or only the lips or only around the eyes or only the tongue, maybe you should ask about every part. If the patient tell you here in history, tell you only lips and face, ask him, do you have swelling in your tongue? Very important, very critical to ask about, because the management will be changed. If he has swelling in his tongue, this is maybe you need urgent treatment. So provoking factors, you should ask patient, do you notice anything can cause these episodes, like certain food, okay, like local trauma, like stress, cold, medication. Maybe the patient tell you that when I'm taking non-steroidal, I develop this swelling. Any relieving factors, as we mentioned, it's self-limited. The patient will tell you it improve without any medication and can be sometimes improved with medication. Associations, very important favor. If you forget to ask about these questions, the examiner will consider you unsafe doctor. If you don't ask about tongue swelling, if you don't ask about shortness of breath, difficulty of swallowing, it change the voice pitch. Okay, this is very critical to ask about any obstructive symptoms: tongue swelling, shortness of breath, difficulty of swallowing, and change in the pitch of the sound. And you should ask about hand swelling if he had swelling in the other parts of the body, like hands. Abdominal pain, nausea, vomiting, skin rash, very important, skin rash, to differentiate between angioedema with urticaria or without urticaria. And itching, Very important to ask about itching. So I will repeat: tongue swelling, shortness of breath, difficulty of swallowing, change the voice pitch, swelling in the other part of the body, abdominal pain, nausea, vomiting. This is associations, okay? Skin rash and itching. Now, if the patient has, this is facial swelling, episodes of facial swelling, you should rule out lymphoproliferative disease. Very important. You should ask about symptoms of lymphoproliferative disease, any change in the weight, change in the appetite, night sweats, mumps or lumps in the body, previous infection, any bleeding disorders like easily bruising, like nasal bleeding or gum bleeding. Very important to ask about these questions. Any previous infections, recurrent infections. Then rule out autoimmune disease, especially SLE and thyroid disease. Very important for angioedema. As we mentioned that we have type of angioedema can associate with autoimmune disease. So you should rule out autoimmune disease. So for this reason, doctor, I told you, do you take full thyroid history? Thyroid history, not only the weather. You should ask everything about thyroid symptoms and SLE. Rule out drug-induced, like non-steroidal anti-inflammatory, also important medication that can cause angioedema. And then hereditary. Hereditary, any member of the family have similar condition, okay? Maybe he told you my father, my mother. Also, if he told you now, no, you can also ask him other questions. Ask him, anybody of any members of your family have disease called angioedema by name. Maybe the patient cannot remember that anyone have similar symptoms, but if you ask him, anyone have angioedema or like this, you can name the disease here better. Then for nephrosis, we know that sometimes nephrosis can cause swelling also in the face, nephrotic syndrome. So you should, طبعا doctor ask me about these symptoms, any frothing in the urine, any also swelling in the other parts, especially for طبعا usually for nephrosis, usually the swelling will be around the eyes, as we know, around the eyes. طيب. But هلا, when angioedema associated with urticaria means skin rash and itching, so the diagnosis and treatment approach will be follow the intervention of urticaria. Okay? Any question, please?
Yeah, Dr. Hassan, I have two questions, if you don't mind.
Yes, please.
Regarding the management, you said for abortive treatment, you said ecallantide and activant. Is this medication for SE induced or for
usually
all?
I told for hereditary usually. For
hereditary.
Yeah, because SE inhibitor induced angioedema, this most likely will be self-limited, will not be severe, and will not affect the airways.
Mm-hmm. So this is for SE inhibitors only?
For hereditary.
For hereditary. Okay, is there any role for EpiPen or tranexamic acid in abortive treatment? Because she said EpiPen.
Yeah. Actually, I reviewed this in many references like Up to Date and other books. Really, it's not mentioned that there is rule for this medication in the angioedema.
Yes, because it's for allergic, I think.
For urticaria. But really, they advise if the patient has obstructive symptoms like laryngeal or tongue. So antihistamine mentioned, and the corticosteroids, it's mentioned can be help.
It's for helping only, but it's not main
but
you cannot depend on it.
Yeah, the treatment C1 concentrate. And also fresh frozen plasma and this medication we mentioned.
What about bradykinin inhibitor?
Bradykinin?
Bradykinin inhibitor.
Yeah, we told that the treatment of a choice in to apport the high C1 concentrate.
Okay. So, sir, can you tell me what about the causes for the angioedema with urticaria?
With or without urticaria?
With urticaria.
With urticaria?
Yes.
We'll come it later for it.
Okay.
We have case.
Dr. Hassan, you said the treatment is the same like angioedema.
Sorry, doctor, your voice not clear.
The treatment of ACE
Yeah.
induce the same like angioedema C1 concentrate, the same management.
No.
Like hereditary.
I thought that treatment of choice for hereditary for AC inhibitor angioedema. There is no definitive treatment for it. They usually only to stop offending medication. This can be resolved over a few weeks. But if the patient has severe angioedema, they wrote in the up-to-date, you can try the same treatment that can be used in hereditary angioedema.
Right. And you said something about thyroid. It has a relation with angioedema. Why is vicious thyroid?
Yes, I thought that the causes, we have 5 causes for angioedema. We mentioned
Yes.
that AC inhibitor induced angioedema caused by other medication like non-steroidal, acquired angioedema, usually this cause associated with lymphoproliferative disease and autoimmune disease, including SLE and thyroid disease.
Okay, thank you.
Yeah.
So, doctor, what is the relation of thyroid disease?
The relation thyroid disease, I told you
Yes.
that this hereditary angioedema without urticaria can come also with autoimmune disease, not by the relation not with thyroid disease itself, with autoimmune disease, SLE and thyroid disease, autoimmune thyroid disease. And this can one manifestation of this disease also.
Yes, what is the relation of nausea and vomiting?
What the
You said that there is, you should ask about nausea and vomiting.
Yeah.
What is nausea and vomiting? In this condition, the angioedema or ACE inhibitor, ACE-induced urticaria. Why nausea and vomiting? Abdominal pain can be understood by intestinal edema.
Yeah. The symptoms of angioedema, even AC inhibitors angioedema or hereditary angioedema, can cause nausea, vomiting, abdominal pain, change in the bowel habits. All these symptoms can be used also during the episodes. This is also manifestations of angioedema. This is very important. Nausea, vomiting. Sometimes the patient can tell you, yes, I have a change in bowel habits, lose motion, but this is less. The tummy pain or abdominal pain, this is the most common manifestations of angioedema, but also can cause nausea, vomiting, and change bowel habits.
Okay.
All these are manifestations. Yes. Please. Yes.
How to explain the like idiopathic angioedema to the patient? Is autoimmune, is protein deficient. That's number one. Number two, in hereditary angioedema, C4 level in between attack will be low. And
Yeah, not only, yes, you are right. Not only C1, usually the investigation for hereditary angioedema, not only C1. We have also other type like C1, C4 also, C1 and C4, and C1Q level, C1
C1
Q. Yeah. So C4 level, C1 esterase inhibitors, and C1Q level. This is the 3. And as you told, C4 can be also in hereditary angioedema low between the episodes. You are right. Yes.
Type. Other thing, how differentiate between idiopathic and hereditary by the investigation?
Hereditary, usually we can do genetic testing for patients. Really, we cannot differentiate. But for idiopathic, you can elicit one cause that I mentioned for you, that idiopathic sometimes there's common triggers like severe heat, severe cold, emotional stress, exercise. This can be caused idiopathic. But really, you cannot. It's difficult to differentiate between. But usually, hereditary, the patient have recurrent episodes of this angioedema with no trigger factor. Usually.
Okay. Any role for prophylaxis in ACE inhibitor like danazole, like any role?
There is rule. If the patient still has recurrent episodes like this, our patient, she has 10 times when stop the medication, she has 10 times. So you can give her but only for a few months, not necessary to give her for a long time like in hereditary angioedema.
Okay. And there is also
any rule for Hassan?
Yes, please.
Sorry, any rule for adrenaline is the treatment of acute attack?
The doctor asked me these questions. Really, it's mentioned in up to date. This is not a definitive treatment, But if the patient has laryngeal swelling or respiratory symptoms, we can try it. But maybe will not help.
Dr. Hassan, is there any specific investigation for ACE induce?
Sorry, I can't hear you.
Any specific investigation for ACE induce?
No, I told no definitive laboratory test can be diagnosed the patient with ACE-induced angioedema.
Hello, Dr. Hassan.
Yes.
Can you change
in this case, the differential diagnosis
instead of calcium channel blockers?
Calcium channel blockers as medication, you mean? Treatment of
No. I mean, can you use ARB instead of the ACE ARB, angiotensin receptor blockers?
The voice interruptions, really. The question is not complete.
Sorry,
Please,
can
doctor,
you use ARB, ARB?
Dr. Hassan answered this question. He said you can use it according to the up-to-date.
Yeah, according to up-to-date can be used, but if better to use the other choices before this medication. But if there's indication for this medication, can be used according to up-to-date.
So, Dr. Hassan, in this case, the patient diagnosed ACE inhibitor. Second differential can be hereditary, but there is no family history in this case.
Yeah, you are right.
Family history. Another thing is that both of them can cause hypocomplementemia. How to differentiate based on laboratory investigation between ACE inhibitor induced angioedema and hereditary angioedema.
Yeah. If the examiner asks you these questions, tell him that this is most likely diagnosed in this patient ACE inhibitors induced angioedema, but maybe the patient still have episodes up to few months after the stop medication. But also some patient with the hereditary angioedema, the first symptoms can start after initiation of ACE inhibitors. For this reason, we should investigate. But if you have now patient, if you come first patient, have angioedema, first time when start ACE inhibitors and it resolves completely after stop, it no need to investigate him because it's very costly investigation. But if the patient has recurrent, you should investigate him. You should do C1 inhibitors and also C1q and C4. This will be low.
Okay, thank you.
So Hassan, C4 will be low in between the attacks and C1 will be low in the attack itself.
Yeah. C4 will be low even between the attacks. Also C1q. Will be low also between the attacks.
Only the investigation C1 and C1q and C4 in other investigations, or only
you should do other investigation like thyroid function test. We should rule out also ANA according to the symptoms also. But this is initial symptoms you should mention to the examiner that I will do also thyroid function test and at least you mention that ANA to rule out other autoimmune disease.
Okay.
And maybe also if you do if the patient has tummy pain, you can do ultrasound or CT should be performed to confirm bowel edema. You can see bowel edema.
Okay.
Dr. Hassan, if the patient has been diagnosed with hereditary angioedema and he have a history of airway compromise.
Yes.
Is it okay to discuss about he wear bracelets?
He will.
And adrenaline pen with him?
Wallahi, should be. Really, it's mentioned this is issue. But I told you maybe we're not effective. But we should have adrenaline pen, yes.
And bracelet?
Yes, should be. Yes, you are right.
Okay, thank you.
But most patients, really, it's not common for patient with the angioedema to have usually respiratory involvement. It's not usual. Only, as I mentioned before, 10 to 20% of patients, 80% to 90% only have facial swelling, hereditary angioedema or other type of angioedema. Most patients have no compromise of the airways.
So, Dr. Hassan, if patient didn't give history of any tongue swelling or alarm sign, so at that case, we should not talk about the EpiPen in the exam.
No, you should not mention. No, not mention.
Okay, thank you.
But also, I forget to mention for you that also one important differential diagnosis of recurrent abdominal pain, severe, moderate to severe abdominal pain. Also, it come in, I think, in one basis exam, and the diagnosis, differential one diagnosis, hereditary angioedema. Sometimes only can be caused only abdominal pain without facial swelling. This is also one I think it come in one diet. That patient have recurrent severe abdominal pain, and it was in the differential diagnosis. And you cannot tell that definitive diagnosis, but you should put in your mind. We'll go to the second case with Dr. I think we have two doctors request from me, Dr. Asma and Dr. Asif.
Yes.
Dr. Asma?
Yes. Yes, I am here.
Okay, Dr. Asma, this is your case. You have 4 minutes.
تمام.
So, Dr. Hassan, can we start?
Yeah, doctor. I'm ready.
Yes.
But I will give set time. 1 second. Yeah, start.
Hello.
Hello, doctor.
Good evening.
Good evening.
I'm Dr. Hafiz, one of the doctor in this neurology clinic.
Yes, doctor.
Nice to meet you.
Thank you, doctor. Thank you.
Okay. Are you Mr. John, 25 years old?
Yes, doctor. I am John.
Okay. I'm here to talk with you regarding your health issue. Is it okay with you?
Yes, doctor. Please.
Okay. So how you are feeling today?
Yes, I'm feeling okay, doctor.
Okay. So you are do you want anyone in this conversation?
No, doctor. I can manage.
Okay. So do you come here alone or with someone?
No, I'm coming here alone.
Okay. So so could you please know me that how far you know about your health condition?
Actually, doctor, I have developed 2 episodes of loss of consciousness with jerky movements, 2 times over the last month. I met last week the brain doctor who requested me brain scan and blood test. So I came today to know the result of this test and know what the exact cause or the possible cause for this.
Okay. So what is your expectation from today's meeting?
Actually, doctor, I read about this on internet and I expect that it's epilepsy.
Okay. So what do you know about the epilepsy? What do you have idea?
Yes, doctor, I read on internet that this is caused sometimes episodes of loss of consciousness and these jerky movements like what happened with me. And there's some treatment can control it. I like this. As general, I know.
Okay, that's great. You are very concerned about your health condition, and you try to learn it. I appreciate it. And now, any member of our medical team have talked with you regarding your health issue before this meeting?
No, doctor, because the doctor was busy that time. He told me he should do these tests and I will meet you soon.
Okay. So, after doing, I have all the test result in my hand, and there is actually good news that the all test results is normal.
Oh, very good.
But that I have a bad news also for you. I'm sorry to say.
Why, doctor?
Because you have sometimes it happen that you have a disease, actually we called in medical term is idiopathic epilepsy. Okay.
So it's epilepsy, you mean, doctor?
Yeah, you are right. It is epilepsy, but there is many variety of epilepsy. Okay, many cause of it. Epilepsy, but it is a variety of epilepsy that I am going to discuss that you have. Okay.
So I expect, doctor, that it's epilepsy, but you told me the result of tests are normal. So how can be epilepsy?
Yes, I'm coming in this matter.
Yeah, please, doctor.
Okay. So is actually epilepsy? What is the condition? Many reason behind it, like brain tumor. Okay, any blood channel abnormality. Okay, many things. Many, even a stroke can happen. Maybe cause, but in your case, you are lucky enough. This is not such cause is come out in the result, and we are very sure now. And but this is a condition where we don't know the cause, but this is a disease. This is a disease where brain become that is stimulated. Okay. That is, brain become excited. I want to say that brain becomes excited. We don't know the reason. There is some imbalance of chemical in our brain. We don't know that why the reason, but it happen. It is many patients in our department like you. Okay.
So, doctor, you are sure that it's epilepsy?
Yes, I'm very sure now that this is epilepsy.
Is there any other test can do to confirm the diagnosis?
No, doctor. No, Mr. John. This is epilepsy, and we are very sure about it. And in case of many patients, we didn't found any abnormality like your case. Okay?
Yeah. So, doctor, will it happen again?
Yes, there is very, there is very chance, very possibility, high possibility to it happen again. But but I want to reassure you that this is a actually treatable condition. Okay.
So, if you give me medication, so this will end this fits completely?
Yes, we can control the fit. Okay.
Yeah.
Okay.
So, I mean, doctor, if I take this medication for some times, I will not have this seizure later on.
Okay. Let me explain something. There are many drug options. Okay, many drugs are available. Our medical science is so advanced, but we can't actually in medical science. Each drug response is very person to person, okay, and it get times to take action in different way in different people. So there is treatment option, and which drug is suitable for you. We try with first line drug. There are some second line drugs, many drugs option. Actually, we are going to start a medication for you, and let's see. We hope that with one drug in many patients it control it. If it is not act, then we can try. Actually, at this moment we can guarantee you that this drug guarantee that no more fit. Even when we start drug, we start in low dose, then we will monitor you closely, follow up you. Okay.
What the name of drug, doctor?
Okay. So there is drug treatment option still not decided, but I want to know. I will refer you to a neurology expert, okay, brain doctor specialist, there is many options, who will decide the best one for you, okay?
So doctor, for how long I should continue this medication?
This medication, I'm sorry to say that this actually very difficult to predict that how long you have to take. But
why?
Because it's depend on control of your epilepsy, okay? Control of your fits. Even in some patient, if it is completely, if you are completely fit free for the 2 to 3 years, even 5 years, then we can think of withdraw of drug. It's actually on situation. It depends. At this moment, it is very difficult to say. Okay? Is it okay?
Yes,
are you getting me?
Yes, doctor. Thank you. Yes.
Okay. So I want to make a urgent. I want to take a urgent schedule appointment with a brain doctor. Okay, as early as possible. Okay, to start the medication.
Okay, doctor.
Okay, and by this, and I want to know that what you are doing.
As mean my job?
What? Yes.
I'm working in an electrical factory as electrician.
Okay. Do you think that in that case you have to handling some heavy things, or there is risky things you have to handle?
Yes, doctor,
I think
really, it's risky, yes, really. because I'm dealing with the electrical current and
till your till your seizure is fit is controlled. Okay,
yes.
I will refer you to occupational health therapist who will
Yes.
consider your job is whether is secured for you.
Yeah.
If it is not secured, then he will try to talk with your employee um, and talk with them so that they relocate you in safer zone, safer place. Okay.
Yeah. Okay, doctor. I appreciate. Yes.
So, do you drive?
Yeah, doctor. I have car.
Okay. I'm sorry to say that actually you have to stop driving. Okay.
Why, doctor? Why I should stop driving? How can I go to
Because
my workplace?
yes, I'm coming. I'm sorry to say that because if you have fit in during driving time, it's not only threaten your life but also in to other people. I hope you are intelligent enough to get my point that this is not risky for you, for other people also, and you don't want this.
So
And
for how long, doctor, I should stop driving? Only 1 month or 2 months or?
No. So you are driving. So I will refer you to DVLA. Okay, this is legal authority
Yeah.
to decide how long you cannot drive. Okay,
Okay, doctor. Okay.
and let me know what is your hobby.
Doctor, I'm swimming and climbing mountain.
Okay, I'm sorry to tell you that this sorts of dangerous hobby you have to like climbing hill is very dangerous for you. So till your condition is your feet not controlled, and you have to avoid this. And regarding swimming, whenever you going to swim, you have to accompany with a person who know your medical condition and who can rescue you if it
Yeah.
happened during swimming.
So
Actually,
I can swim if anybody with me.
if he is aware of your medical condition and he is capable to rescue you, but I think it's better to quit swimming if possible till your feet is controlled. Actually, it's matter of life.
2 minute training. 2 minutes. Yes,
Okay.
doctor. Yes. Yes. Okay, doctor. I appreciate.
Okay. So do you with whom you are living?
I'm living with my parents.
Okay. I hope they are supported in your
Yeah,
family.
doctor. Yes.
Yeah. Okay.
Yes,
I want to tell you something that you have to need some precaution. Yes, till you have your feet control. Please don't lock the washroom when you go to washroom inside, because it is dangerous actually. Okay, don't go for shallow deep bath and avoid any sorts of fireplace like that. Okay.
Yeah. Okay, doctor.
and
Appreciate.
and I want to let you one thing, that if your feet is you think is more than it's better to educate your family as well regarding this condition. At this, what to do, I think you can come in the next appointment with them so that we can educate them. And if it is persists more than 5 minutes, I think you need urgent medical attention. Okay.
Okay. I appreciate, doctor.
Okay, thank you. Do you smoke?
Time off.
Okay.
Okay, doctor. Thank you. First of all, you forget something very important. When the examiner tell you that it's remaining only 2 minutes, you should ask the patient, what's your concern? You don't ask me, what's my concern? This is very important question. This is for this question only there is 4 marks. 4 marks. You see how much is important. So this is very important to ask patient, what's your concern? And try always to remind yourself when the examiner tell you that there's 2 minutes remaining, Whatever you are talking, stop your talking and ask patient, what's your concern? Answer his concern. Okay? Because if you continue to talk, maybe you will forget to ask the patient, and this really will you will lose 4 marks, and sometimes can lose the examination if you forget it also it in the other stations. I mean, if you forget to ask the concern in station 5 and in station 4, you will fail in the examination about for you don't manage the patient concern. Okay? Because there are marks for concerns. Okay? The other thing, doctor, you told me that I can swim if I have another one with me. So it's right for patient with epilepsy to tell him you can swim if you have anyone know that you have seizure, or what's your opinion?
So you to want to tell that I have to told him strictly avoid the swimming. Yes.
Yeah, because
Okay.
if we suppose that one develops seizure while he's swimming, nobody can help him. You know, during the seizure, the patient will be his body will be spastic, and also his weight will increase. And especially if he's in water, nobody can help him. Maybe he'll die. So he should stop swimming. He should stop. No any options. Stop swimming. Stop swimming. Okay. طبعا to manage alcohol consumption here very important also,
Yes.
because we know that alcohol over dose can cause seizure, and as we know that also alcohol can interfere with the medication that can be used in the epilepsy. So very important here to counsel the patient about alcohol. Very important, don't forget. And also illicit drug. Here in this scenario, very important to ask about illicit drug or recreational medication. Why? Because also can cause seizure, as we know. Okay? So the other issue here, you are very good when you tell the patient that because you don't tell him any medication per se, because many candidates, when the patient asks him what's the medication, they mention for him one medication. No, here why don't mention in the scenario, so you cannot mention to the patient what's the name of medication. Here simply you can tell him now the consultant in charge will start one medication for you according to your situation. Okay? And we suppose that as in a clinic, sometimes we set the consultant and specialist. The specialist will explain to the patient everything, while the consultant give medication. And you can tell him soon, yes, consultant, because you are now in neurology clinic. You are not in other clinic. Yeah, now you are in a neurology clinic, but you are now senior house officer. Your consultant tell you now to explain him while to see the other patient. I will come. So this is the issue. So tell him that now our consultant will meet you also, and will he put a management plan for you. Okay? I mean, don't tell him that I will refer you to brain clinic because now the patient in a neurology clinic now it's mentioned above in the scenario that you are senior house officer in a neurology clinic. So you cannot delay the patient with treatment. Tell him that the consultant now he will decide the management of plan for you and will start as soon as possible. For how long should... let us continue now our questions. What are legal issues in this scenario?
Legal issue is driving is the legal issue here.
Yeah, driving, DFL, to inform DFLA. طيب,
Yes.
what do you know about rules of DVLA after seizure?
That I know that after if single seizure, if there is provocating factor, I think then 1 month. If without provocating factor, I think 6 months. 6 months after single seizure, and if it is epilepsy or like a tendency to recur, and at that time till control, I think driving will stop.
Okay. Actually, the answer here, we have two groups of license. Group 1 and
Yes.
Group 2. For Group 1, at least 1 year, even if it's provoked. And or even usually 1 year, but sometimes can be 6 months in special circumstances, like if the doctor change or decrease the doses. I mean, if the patient has seizure, he should stop driving for 1 year. But sometimes, if the patient already on medication and his doctor changed the doses and he has seizure, here can be only for 6 months. But the rule, 1 year. Okay, 1 year. For group 2 license, okay, 10 years. 10 years. Okay, it should be free seizure for 10 years. طيب, who the one should inform DVLA, you or the patient?
Yes, patient should inform DVLA. If patient is denying to do that, in that case I have to inform.
You also you should inform. If the patient now, you tell him that stop driving and he's still driving, you will go to the DVLA and tell him that this patient still drive?
I think so. I'm not sure.
And anyone else has answer?
Yes, I will inform the DVLA.
Directly, if now the patient tell you I'm still driving, so directly you will go to the DVLA?
No.
Doctor, I think when you inform the patient, you tell him, I will write that in your notes. If anything happened to you, you will lose your license and will be in trouble. And if again, I think should be warned again that this is
warning.
Again, it's the law to do it.
So repeat
and then
the warning.
Yes, we will tell other authority to take higher authority to speak.
Yeah. So first of all, you should re-talk to the patient. You should warn him. Okay. So the guidelines, GMC guidelines, state that you should once again remind the patient that the patient should stop driving. Okay. And if you find that the patient continue to drive despite repeated warning, you can inform the medical advisor at the DVLA, but should tell the patient first. Yeah, you should tell the patient, I will go to do this. Okay, but don't do this before to retell the patient and explain him the dangers of this, and also you can seek also the other advice from your senior doctor or from legal office in hospital. So this is very traditional case, epilepsy traditional case in basis exam. This is, I think, when start to do this exam, they start these cases. Epilepsy, it's very old case and very important case, and they repeat it many times. Always they repeat this case. Why they repeat it? Because epilepsy is common disease, and you should counsel the patient about something, about driving, about hobbies, about job. So,
Dr. Hassan, one question I have. So you said we have just to prevent the patients from doing many sports. Do we have to tell him by name, like to specify the
yeah, you are right. First, yes, you are right.
swimming?
Yeah, you should ask him what his hobbies are first. Yes, you should ask him what your hobbies. He will tell you, so you should counsel him for his hobbies. Later on, in precautions, you can mention for him. In precautions now, we mention something else about to avoid high altitude, about to dealing with sharp instruments, to dealing with fires, like this, okay? And some hobbies that can be dangerous for him. But in precautions. But first of all, ask him what's your hobbies and counsel him about his hobbies. So.
Okay, and with regard to the medication, when the doctor said, I will ask my consultant, so it's the best answer, or you want to have another answer?
Like what, doctor?
Like she said, we will inform we will tell you what is the anti-seizure medication we will start after discussion with the consultant.
Yeah.
It is the best because she didn't specify anything because there's nothing in the scenario.
Okay. Yes, all right. Don't mention any medication. As I told you, in the hospitals, large hospitals here, in King Faisal or like this, the specialist will sit with the consultant in the same clinic or two clinics separate. The patient first will see the specialist. He will talk with him. After that, the consultant will come and decide the management plan. This is in many hospitals do like this. So now you are senior house officer, who's the one you will talk the patient and explain him the disease, and now the consultant will come to put management plan. It's very easy. Okay?
Thank you so much.
Okay. So how can first explain the patient about epilepsy? As I told you before, epilepsy is common disease. So as any common disease, you should tell the patient that it's common disease. Okay? When I will mute my colleagues can ask any question. So, first of all, tell him that طبعا you should hear break bad news. Epilepsy is bad disease, bad news for patient. Anyone who know that he has epilepsy will be very bad news for him. So you should hear break bad news. Yes, the result of this is normal, but first of all, tell him that I'm sorry to tell you that the news today I will proceed for you is not as we hope. Okay, you have epilepsy. So here we should break bad news for the patient because it's bad news. Anyone of us, if he know that he has epilepsy, will be very sad, very sad. Okay, so it's bad news for him. So, and then explain what the epilepsy. Please, any disease is common, tell the patient is common disease. Why? To know that it's not him alone affected with this disease. So epilepsy is a common disease. Epilepsy causes usually repeated seizure. Now, what's the seizure? Seizure is brief episodes, last from second to few minutes and sometimes longer, caused by burst of abnormal electrical activity in the brain. Simply, no need to go in more details. So, seizure is brief episodes last from second to few minutes and sometimes longer. What the cause? Caused by burst of abnormal electrical activity in the brain. Now, this seizure, what the symptoms? This seizure can cause, this seizure can be simple sometimes without loss of consciousness, only cause jerky movements or abnormal sensation or change behavior, and sometimes can cause loss of consciousness like what happened with you. Now, complication of epilepsy. So, definition of epilepsy, symptoms, now complication. You forget, doctor, to tell me that complication that we should, when you mention for any patient the complication of disease, so he will accept the treatment. So you should mention the complication. The most important complication that the patient sometimes during the seizure can develop serious complication like fracture or head injury. The other complication that if this disease not managed well, so the patient can develop status epilepticus. That this means case of persistent seizure, and this can be life-threatening complication. So, what's the definition of disease? Simply burst of abnormal electrical activity in the brain. Then symptoms. This can be simple or can be with loss of consciousness. Then complication, fractures and head injury, and status epilepticus, that this can be life-threatening complication. Now, we go to the other thing, the cause of seizure. Yes, you should mention, no need doctor here to tell the patient that one cause of a tumor or the stroke, and no need, because maybe the patient, I have a tumor, and you will put yourself in the other issue. Don't tell tumor, don't tell stroke, because the patient now will feel afraid. Maybe the patient not hearing well, not listening for you well. So I have a tumor and he crying and like this. So simply, most of cases, no cause of seizure can be found, and this is called idiopathic, like in your case. Abnormal burst of electrical activity in the brain occur for no reason. Okay? Sometimes tell him yes, sometimes can be family history or family factors may play a role in the part of some people. Okay. For this reason, your tests were normal. If he asks you why test normal, so tell him that most cases with no cause. For this cause, your tests are normal. Then here, simply, you should take medication called anti-epileptic, that this can control the disease and prevent the seizure. Not curable, not curable. Not will cure the disease, will control the disease, control and prevent the seizure. Okay? When he asks you, will this medication stop fits completely? Appreciate his concern and tell him, yes, it's effective medication and usually control the disease in most of patients. But nobody guarantee that will not develop seizure while you are taking this. But it's uncommon, and with regular follow-up and observing you, everything will be under control. So nobody can guarantee that you will not have seizure while you are taking antiepileptic, but this is usually uncommon, or it's less common. And with regular follow-up, will follow you regularly in our clinic, and everything will be under control. For how long I should take this medication? All of us know that epilepsy is not a curable disease, but some patients can stop medication after 2 or 3 years and sometimes 5 years, as Dr. mentioned, yes. But many patients can develop seizure, and the proportion of the people that can develop seizure after stop medication up to 30 to 50%, this is not low. So for this reason, when he asks you when we should stop this medication, simply appreciate his concern also. And as I told you, this medication will control the disease and prevent the seizure. And you have regular follow-up in the brain clinic. And the duration of medication will decide by consultant depending on your response to treatment. Simply. Then will decide by our consultant depending on the control or your response to treatment. Alcohol is very important here to ask about alcohol, and also if the patient drinking, like this patient, if she asks me, doctor ask me, I will tell her I'm taking large amount of alcohol. Here you should counsel me to decrease the amount of alcohol, because for two reasons: that increased alcohol intake will maybe cause seizure, and also alcohol overtaking will also interfere with the medication, with anti-epileptic medication, and can be reduce its efficacy. Also, when I can resume these hobbies, very simple, I can imagine how much it's difficult to stop your hobbies. But really, this is type of hobbies has high risk on your health and will follow you regularly and will be decided by consultant depending on your response to treatment. Also, don't tell him duration, because we don't know. Maybe the patient has recurrent seizure or like this. Also for driving, same thing, you can answer same answer, or you can mention for him, no problem. For driving, this is rules. Every one of us know that any patient with seizure should stop driving for 1 year. So not wrong to mention the patient you should stop now at least 1 year after this last seizure. No problem. But if you don't remember in the examination, you can simply tell him that this will be decided by DVLA. You should inform them and will decide how long you should stop driving. For job, طبعا, for job, also you should counsel him if he has risky job. This patient has risky job, electrician and dealing with electricity, so you should tell him about his job. For precautions, here very important in epilepsy. So in epilepsy scenario, we have 3 important things: hobbies, sorry, four hobbies, job, work, driving, and precautions. Precautions for everything dangerous for the patient. Anything you can remember in exam, tell him. Can be risky for him. Like, first of all, also you should tell him, the patient, what the factors can cause seizures, like lack of sleep, night working, excessive alcohol, irregular meals, or skipping meals. Okay. Flickering light such as strobe lighting or video games, overuse of electronic devices like video games. Okay, some medication, so tell him that you should inform your doctor before to take any treatment, even over-the-counter medication. Okay, so now you should tell him first that what factors can provoke the seizure. Okay, then you can ask him to avoid that dealing with sharp instruments and avoid high altitude, and also, as Dr. mentioned, that to avoid fire. Also, don't lock the door while you are take shower or like this. Okay.
Okay, doctor, what about pregnancy and contraceptive pills?
Yes, if she's female like this, no, also you can tell her same thing. If she tell you, doctor, if I will get pregnant, so what I will do? Yes, appreciate your concern and tell her that this will follow. We have a regular follow-up with a brain doctor and woman doctor that will decide a good management plan for you. And also there's some medication can decrease the risk of abnormalities in your baby.
Dr. Hassan, regarding driving, like he should be fit for 1 year on medication or without medication?
A first seizure without medication, 1 year. If a patient indicate for medication, also 1 year.
On medication.
Yeah, even if the patient has first seizure in his life, so 1 year also without medication. And if he has epilepsy need medication, also 1 year with medication.
Okay.
Dr. Hassan.
Yes.
The thing about his driving, I will inform him about 1 year or 6 months, or I will let for the delays will decide.
For 1 year or 6 months?
I will tell him about the duration for stop driving, 6 months or 1 year.
No. 1 year. 1 year.
I will tell him 1 year, or I will tell him.
If you see, doctor, you should know this answer. You should know that the patient. You should know that patient with the seizure should stop driving 1 year according to the DVLA rules. But if you forget or you would not to mention for the patient, you can tell him simply that will be decided by DVLA. Okay? But if you know the answer, tell him why not. This is rules. Yani this is rules. No, all body should know it.
Yeah, and about the definition of epilepsy, when I explain him the disease, I will tell him some electric activity. Although there is nothing in the investigation, the same I will explain him because it's part I didn't hear for.
Yeah, simply tell him that this is a burst of electrical activity in the brain, and most of cases there is no cause of seizure can be found, and this is called idiopathic.
Dr. Hassan, if there is a reversible cause of seizures like electrolyte imbalance, then do we have to give these precautions?
You see, I remember one British consultant of neurology told us that he don't believe that anyone have. You mean provoke epilepsy? What do you mean provoke? And you mean by lack of sleep or by other thing?
Like, I mean, suppose he has like a low sodium or anything.
No. This is other thing. This is underlying. There's underlying cause. This is other thing.
In that case, we don't have to give any of these precautions.
No. This is other thing. This is symptomatic seizure. Symptomatic seizure. This symptomatic.
Okay. Right.
But I mean, because I mentioned for you, this is in one conference, a British consultant told us that he don't believe that there is provoking or unprovoking seizure. Why? Because if you suppose that we have two guys, they didn't sleep at night and sitting together and they didn't sleep and drinking alcohol and drinking anything else, one of them, he will develop seizure and the other will not develop seizure. And if we repeat this, also the same one, he will develop seizure. So he believed that there is something underlying in our brain, make us more sensible to develop seizure. But this is other issue, low sodium or tumor or stroke or like this is underlying. This is symptomatic epilepsy, symptomatic. So this reason, yes, can be resolved completely. Even no need medication in these cases. And if the patient has hyponatremia and develops seizure, no need antibiotic, only correct the sodium and no need to give him anything related to epilepsy. He has no epilepsy, he has symptomatic seizure. Any question, please?
So he can drive also, this hyponatremia, seizure, everything he can.
Autotenzil?
Yes, sir.
Yes, what's your question?
I mean, he can even drive and he can even do everything normally. Patient with hyponatremia.
No, he cannot drive. Even the patient he has symptomatic seizure cannot drive also.
No, I mean like in a hyponatremia patient, if you've replaced sodium and the seizure, like the patient has.
Even he cannot drive. That patient cannot drive.
He cannot?
He cannot drive. Even it's seizure. Either provoked or unprovoked should stop driving for 1 year. But I mean for counseling the patient, because this is symptomatic seizure, yes, you no need to give him this all precautions and like this.
Like the hobbies and the job, they can be carried out still, right?
Yes.
Okay.
Please, Dr. Hassan.
Yes.
Like this scenario, if we don't know for how long.
Is it suitable to give this patient a medication like diazepam or something like this, suppository or injection to abort any future seizure?
No. You need that diazepam. This is other issue. This diazepam. This is, we know that this is used only in status epilepticus, not in the seizure. Seizure itself, no need to no need any medication. If seizure usually self-limited, as we know, seizure itself self-limited, no need any medication. But diazepam usually use it as first line of status. If the patient has seizure last for 5 minutes, you can start diazepam. Other than, no need.
Also, Dr. Hassan, I think
Okay, thank you.
if we forget the duration for how long we have to stop driving,
yeah,
we can say for him, I
yes,
will
you are.
inform you back soon. So I can ask my consultant instead of telling him that go to the DVLA.
Yeah, or simply you can tell him that will be decided by DVLA, who the one decide the duration of stop driving, and you can review their website on internet because it's written in their website. If you go now to DVLA UK, we can find this. You can find this. Any one of us can find it. So this is, I mean, tell the patient this is will be decided by DVLA. This is the authority who will usually decide how should the patient stop driving, and you can find in a website or you can ask them.
Okay.
Last case for Dr. I think Asif, he's here.
Yes, sir. Station 5, you know.
Yeah, session 5. You have only 2 minutes.
Okay.
You can start, Dr. Asif. Dr. Asif, you are ready?
Yes, I can start.
Start.
Sorry, my
Start.
mic is off here.
Start.
Yeah. Hi, good morning.
Good morning.
I'm Dr. Khan, one of the SHO in this clinic. Mrs. Solmia,
Yeah,
32
doctor.
years old.
Yes, I'm Sonia,
Okay.
32 years. Yes, doctor.
Okay. It is came in my knowledge that you have swelling in your face with itching since 6 weeks.
Yes,
so,
doctor.
and you did 2 episodes. So, can you tell me, ma'am, about it more?
Yes, doctor. Really, I have 2 similar episodes 2 weeks apart of swelling of my face.
Mm-hmm.
Yeah.
Okay. And is there any episodes before also?
No, no, only this starts 6 weeks before.
Okay. It is the second episode is it is increasing intensity or same like?
Same, doctor. Similar, really. Same.
Okay. Do you think anything it is increase anything any factor it is increasing?
Really, doctor, I fail to
or
recognize.
aggravating?
Yes, really, doctor, I fail to recognize any cause for this.
Oh, any food association or
No.
any you take any medication?
No, doctor, no medication, no food, really.
Okay, I appreciate your concern. Okay. You have any significant medical condition before when you
No,
admitted
doctor. No,
in the
doctor.
hospital or any
No.
surgical history?
No.
Okay. You have any swelling in other areas like hands or in your abdomen
Yes,
between on the
doctor.
same
Yes.
time?
Yes, yes. I have some discrete skin swelling on both hands and also in my tummy
Mm-hmm.
that were
As well as
itchy
you
and
have,
red. Yes.
okay, and it is also you have tummy pain as well?
No tummy pain.
Not tummy pain. Okay. So on that time you have when you feel the tummy swelling the tummy, you have any diarrhea or you have any
No,
loose
no.
motion or
No, doctor. This swelling only the
uh,
skin, on the skin.
okay, okay. You are taking any medication
No.
for any? Okay. You have any lumps and bumps or increased weight or decreasing weight?
No.
You have any? You have. What about your appetite? It is okay
It's okay, doctor.
or
No
it is
change.
decreasing?
No, no, don't change.
You have any body rash?
Doctor, not body rash, only as I told you when I have this swelling in my face. Also, I have this is rash on the skin, on both my
Mm-hmm.
hands and also in my tummy.
Rash as well.
Yeah.
Okay. Um, okay. Uh, what about your? You have any joint pain?
No.
Okay. What about your? You have any racing of heart?
No.
What about your water work is okay? Any decreasing or
Yes. It's
increasing or
no, no,
anything?
doctor. No change. No change.
Any fatty urine?
No.
Okay. Uh, I repeat it again that do you have this episodes you told me that it is increasing any food or anything or any due
I
to the
didn't.
any
I
weather
didn't notice,
changes?
doctor. Really, I didn't notice at anything.
Okay. Do you have any significant family history in your this?
No.
Okay. Do you take alcohol?
Sometimes, occasionally, doctor.
How many units per week?
Only 2 units or like this.
Okay. Do you take cigarettes?
Yes,
Smoking cigarettes?
I'm smoking 10 cigarettes daily.
Okay. If you don't mind, then it is better to leave this smoking, and I will refer to you to the smoking cessation clinic because
Thank you.
sometimes it is injurious for the health as well as about this
Thank you.
condition as you told.
Thank you, doctor.
Okay.
I appreciate.
This okay. These symptoms affect your job as well.
Really, doctor, not much more because only 2 times I have this and resolve within days.
Okay. Can I ask some personal question as well, if you don't
Yes,
mind?
yes, doctor.
Do you have using any illicit
No,
drug?
no, doctor, no.
Okay. What about your sexual relationship? You are married or a boyfriend?
I'm married, doctor.
Okay. You have any extra
No,
other sexual partners?
no,
Sorry to
doctor.
ask.
No, doctor, no.
Okay. Can I examine you?
Yeah, please.
What is your vitals?
It's stable. Blood pressure 120/70 and heart rate 90 and also respiratory rate accepted and no fever.
Chest?
Chest
Any
normal.
weight?
No any wheezing.
Cardiovascular?
Normal.
Abdomen? Any liver enlargement or splenomegaly?
No.
Any can I check the any skin rash at present?
No skin rash.
No skin rash.
No.
Okay. Um. Okay. Any joint swelling or any?
No.
Okay. Okay, ma'am. You have any what is your periods? It's okay.
It's okay, doctor. Yes.
You have any significant medical concern regarding your blood? You have any blood disease or?
No. No, doctor. Before I have no nothing.
You have how many children you have?
One only.
Any history of the miscarriage?
No.
Okay. Okay. Anything you want to be included, or I miss any symptoms that you feel, any other symptoms like headache
No,
or
doctor.
any double visions during during this?
No, only this. I have this swelling in my face and also itching skin rash, and my
Okay.
face also become itchy.
Okay. Okay. Okay.
1 minute, doctor.
Okay. What is your concern?
Doctor, my GP told me that it's urticaria and refer me to know what is the cause of this. So what can be cause?
Actually, sorry, and I appreciate your concern. Actually, there are different things in my mind. Yeah, you may have a urticaria with like angioedema as well. Sometimes there is no cause for this urticaria. Sometimes it is idiopathic. Because I took all information from you, so it is came in my mind that it is due to the idiopathic. So, but for confirmation for my diagnosis and to see the other then I will to check the further blood test as well as the some imaging. Then we will tell you again.
Thank you, Dr. Asif. What's your diagnosis?
Thank you very much. My diagnosis is idiopathic angioedema with urticaria.
So angioedema with urticaria, okay?
Yeah.
So, what the differences between both angioedema with urticaria and angioedema without urticaria?
Actually, angioedema without.
I mean in etiology.
Etiology.
Or pathophysiology.
Angioedema is, I think it is, as we discussed previously, C1 and C4 inhibitor deficiency.
Yes, all right.
Angioedema,
yeah. Angioedema usually bradykinin mediated. Mediated. While urticaria, angioedema with urticaria, mast cell mediated.
Mast cell histamine. Yes, okay.
So this is the differences between it. And usually in angioedema with urticaria, okay, usually due to allergens, okay?
Mm-hmm.
And usually this patient would have urticaria and pruritus itching in most cases. And in in the severe episode, the patient can also has anaphylaxis, okay? While in angioedema without urticaria, what's caused by bradykinin mediated, usually the patient has no urticaria, no pruritus, and anaphylaxis are not present, rare. Anaphylaxis rare in these cases. So we have two angioedema with urticaria and angioedema without urticaria. With urticaria usually caused by allergens, and we can later on discuss this. So what are precipitant cause of angioedema with urticaria? Precipitant cause.
Any
and this important question, really, why important question? Because this answer, this what should ask in the history, what this should ask in your history. So you should know this answer very well.
Actually, patient could have a history of the asthma or family history of the asthma. Patient may have a pets in the home, or sometimes it is increasing due to the weather changes as well.
Yes.
And weather changes, there is a pollens that can cause.
Yeah, very nice.
And yeah, and I think some medication as well that can cause urticaria.
Medication, yes, you are right. Yes. So now we will mention it all. So the other question, and this is also very important questions. This is the question very important also. Why? Because also you should ask in your history. What the disease can cause angioedema with urticaria. We mentioned for angioedema without urticaria, we know autoimmune disease and also lymphoproliferative disease. What the disease here can cause angioedema with urticaria? This is also important question.
I think
Same disease, lymphoma,
yes.
SLE and thyrotoxicosis. SLE, thyrotoxicosis, and lymphoma. This disease can associate with urticaria. What are the management for this patient, my patient now? What management?
Management, as you said, it is antihistamine medications, antihistamine, as well as the corticosteroids.
Yes.
Mast cell stabilizer, yes.
For corticosteroid now, no need corticosteroid, but antihistamine, yes, you can give her because maybe this patient will develop chronic urticaria. So antihistamine, yes, non-sedating, you can mention for examiner better, non-sedating antihistamine. Mention this better.
Antihistamines, yes. Okay.
Mention non-sedating. Better, like loratadine and cetirizine. Top, okay.
Okay.
And also, what you advise patient?
We will advise to avoid any precipitating cause. For example, if he's taking any medication, then we will tell that to avoid the medication. Or for example, if the patient has a disease, so the treatment of the disease is very important.
Yeah.
And
Here, the most important thing in this scenario to advise patient if she has severe symptoms, that tongue swelling, if she has shortness of breath, if she has difficulty of swallowing, to seek urgent medical advice, to come to emergency directly. Okay, if she has stridor, very important. This is the issue should be advised the patient because this can be life-threatening. Okay, thank you, Dr. Asif. Here, there's two things more important in this scenario.
Thank you,
yes, thank you. The precipitating cause of angioedema with urticaria is trauma, local pressure, emotional stress, inhalatory allergen like pollen, like animal dander, insect bite, sometimes we know, extreme cold or heat, allergic contact substances such as metallic jewels or dog or cat hair and saliva. Food allergen, very important, strawberry. We know strawberry, many people are allergic for strawberry. Food coloring, shellfish, chocolate, peanuts. So this is the cause usually. And the disease that can cause angioedema with urticaria, as we mentioned, this disease, three disease, SLE usually, thyrotoxicosis, lymphoma. So you should concentrate in your history about this issue. So facial swelling in examination, while to see facial swelling outside, you have two differential diagnoses or three. So with no urticaria rash and no itching, when you take the history from patient, if there is no urticaria rash and no itching, so this is angioedema as we discussed in the first case. If the patient has urticaria rash and itching, so this is angioedema with urticaria, and here the approach will be something different. So for urticaria, it's very important to identify the cause, like as we mentioned, trauma, local pressure, emotional stress, any allergen like pollen or animal dander, insect bite, extreme cold or heat, any jewels if the patient use now new jewels, if there's any animals contact, if there's any food allergen like fruit, food coloring, chocolate, like this. And you should ask the patient, and this is very important, about any previous medical history of asthma, allergic rhinitis, eczema. You should mention by name, not only because now you have allergic history, so you should ask about previous history of asthma, allergic rhinitis, eczema. Then, as we mentioned, you should take a history about the disease that can associate with urticaria, like SLE, lymphoma, thyrotoxicosis, and drug history. And doctor, here you forget something. I told you before, first scenario, this is important. If you don't ask, the examiner will decrease your marks significantly about tongue swelling, about shortness of breath, about change the voice pitch, about difficulty of swallowing. Please don't forget it. And stridor here very important, because if the patient had these symptoms, so you should give him adrenaline pin, okay, pin. So very important, because management plan will be different if the patient has any significant symptoms of upper respiratory obstruction or laryngeal swelling. So please don't forget, any patient has swelling, this question should be asked. Don't forget. Any question, please?
Sir, in examination, what should we see in this patient?
Very important. First of all, this we should look for. If he has skin rash now, you should look for where is it is rash. If you have the patient has no rash, like in our patient, this is general examination, but you should feel the examiner that you are look for signs of SLE, thyrotoxicosis, and lymphoma. So should examine the hands, should go to the examine proximal muscles for any proximal weakness, should examine the neck if he has any goiter, and examine the lymph nodes for lymphoma. Like this, simple examination, general examination and simple examination.
Dr. Hassan, please.
Yes.
The adrenaline pen decided to the patient if only he has symptoms of stridor or tongue swelling or swallowing problem.
This patient, if the patient has symptoms, can be like stridor, especially if the patient has stridor and the family brought him to ER directly, and yes, this patient should provide them with adrenaline pens.
Adrenaline pen like insulin pen?
Wallahi, we can send this as picture because I have this picture before. I can send to you, and this is about its indication.
And it's the only indication for adrenaline pen if the patient has with his attack of angioedema,
stridor, especially stridor or severe shortness of breath.
If no, I will not give him. If he had it.
No. If no, خلاص, the patient. If no, the patient can come. And usually, you will put patient in if he has recurrent episodes of this patient. You will provide him with antihistamine medication. I mean for chronic urticaria, okay. And the patient simply, if he has severe symptoms, can come to ER or his GP and take antihistamine and steroid. But for adrenaline pens, only if the patient has compromise of the upper way, airway.
Thank you, Dr. Hassan.
Okay, thank you. Other question, please.
Yeah, doctor, regarding the bradykinin. So the bradykinin is the mechanism in angioedema, which is the hereditary one you said, yeah?
Yeah.
Okay.
We mentioned that we have also in ACE inhibitors angioedema. We have angioedema with urticaria and angioedema without urticaria. This with urticaria, this usually mast cells mediated. Without urticaria, usually bradykinin mediated.
Dr. Hassan, the management of angioedema without urticaria.
Without urticaria, we mentioned before in this, you don't attend the station.
Yes, I don't attend.
So we mentioned that there's aborted medication like C1 concentrate, C1 inhibitor concentrate, and also we have also fresh frozen plasma we can use. And we mentioned two medication. Its name really difficult. I read it from. I can mention now for you. And we have also preventive treatment. Usually, if the patient has recurrent episodes, we can give him ketoconazole.
He is taking regularly.
Ketoconazole. Yeah, if the patient has hereditary angioedema and he has recurrent episodes.
And the C1 concentrate he take in the emergency.
Abortive, yes. If it's not available, we can give him fresh frozen plasma, and also there's two medication. Any doctor can remind us by name because really I cannot. I read
Actipan, yeah, doctor. Actipan.
I can't open.
Icatibant.
Yeah. This one medication, first one.
This bradykinin inhibitor, icatibant.
Yeah, this one.
Activant and ecallantide.
Yes. Any other question? Okay, thank you for your attend. I will try Tuesday. I will try Tuesday, inshallah. Be on time. Goodbye.
Jazakallah khair.
Thank you very much.
Thank you very much.
Thank you very much, sir. Thank you.
See you, inshallah, soon.
Thank you very much.
Thank you.